Hi there, ladies. I'd like to welcome you to the Revive and Thrive podcast, and I'm honored to have a wonderful guest with me today. Her name is Mrs. Kehinde Ekpudu. She is a registered clinical social worker. She runs her own private practice. She has additional training in EMDR, which we're going to be talking about in a little while. She's an author and she's the founder of Twin Ocean Services, a service that is dedicated to helping individuals struggling with a wide range of emotional problems and issues. And she also helps help people navigate sexual challenges. I would like to welcome you, Kehinde, to the show.
Thank you for having me, Dr. Roberts.
Today, we're going to be talking about a topic that is used pretty loosely, and that topic is trauma. We're going to start by really honing down on the meaning of trauma. And I'll just ask you, Kenny, what is trauma?
So, trauma honestly is what happens inside your body. So, it's not really the events, because people usually associate trauma to an event or something happening to them outside of their body, but it's actually how your body is responding to something that happened externally. So it's the other way around. And so that's what trauma is. And trauma shows up in different ways. It can show up in ways where you find that you are very hyper vigilant. You find that you are very avoidant as a person. Even some of the symptoms of trauma could show up as expressions of anxiety and depression as well. So that's what trauma is.
So trauma is actually not what scares you. It's the way you respond to that thing. And it's when it becomes, we use this term when we're discussing maladaptive.
Yes.
So you did use the example of being involved in a car accident.
Yes.
So what is maladaptive behavior?
So maladaptive behavior or ways of coping are the ways the brain has learned to respond to a situation. So, for example, some of the responses which I could have highlighted again is fight, flight, freeze. And so all these types of responses are the ways the brain trains or sends messages to the body to protect the body. And the example Dr. Roberts talking about is like people that have experienced car accidents. When they've experienced a car accident, often at times folks don't want to return to the car. Your brain is telling you, even though there's the possibility of you having that car accident again and happening the way it happened in the past is almost slim or to nothing, but the brain takes that event and kind of imprints that on our thoughts or in our, I don't know how to say it, a part of our brain where every time you're close to a car, every time you're inside a car, you begin to either feel like you need to run, or you begin to disassociate where you kind of fall and you're just not able to, you get numb. And so those are expressions of maladaptive behaviors. And what happens when it becomes, why we call them maladaptive is because they begin to impact your ability to function. So in 2026, you can't imagine that, okay, yes, you had an accident maybe 5 years ago or 2 years ago, and then you tell yourself, because of this experience, I cannot drive. So that's how your nervous system is reacting to that trauma.
Awesome. Thank you so much. So it's when it becomes maladaptive, when it becomes long-standing, when we just feel like we're in a big trap because of the trauma that we experienced or the negative effect or negative experience that we had. How does emotional abuse contribute to trauma? Because on this Revive and Thrive podcast, I like to encourage women, especially women that have gone through emotional trauma. So emotional trauma is not like a car accident. It's not like being hit. It's not like bleeding. It's not like the bruises you see, but it's more internal. So how does emotional abuse contribute to trauma?
So emotional abuse looks like, shaming. Emotional abuse looks like not being able to speak up for yourself. So when you're experiencing emotional abuse, I think what you're trying to ask me is what does emotional abuse look like and how it can become a traumatic
experience.
Okay,
yes.
so if for example, you have a partner that is always shaming you, always criticizing you, always insulting you, always comparing you, that's the emotional abuse. How it becomes trauma is when you internalize those those experiences and begin to believe those experiences and actually kind of embody them. And so how does that show up in your body? It shows up in your body as maybe you being hypervigilant, you being silenced, not being able to speak up, you doubting yourself. Self-doubt is a big one. Lack of confidence is a big one. Sometimes because you've internalized it, there's also an overwhelming sense of guilt. If you find yourself in spaces you can't really maybe be yourself. Exactly.
Exactly. So those are some of the ways that it manifests. We come from the African subcontinent and we are extremely religious. We also have our cultural beliefs. And growing up as a child, therapy for trauma, even trauma, wasn't something we talked about. Oftentimes, when you experience something negative, it's either we say, oh, the witches are after you, or they're following you from home, or we say, oh, this is Satan's fault and everything. Are there cultural factors, especially for those of us coming from the African subcontinent, that can impact the way we respond to trauma?
Yeah, that's a very good point. And my opinion is not it's not a popular one, but I will say that when it comes to working through trauma or mental health, oftentimes people use religion as an avoidance, way of being avoidant. And so it excuses them from being accountable for actions or when they find themselves in certain environments. I think the classic one is when you're in domestic violence or domestic abuse, and we've heard about tropes where people say just pray for the partner, right? How do you pray for someone that has a fundamental issue and is not willing to change? So instead of taking yourself out of the environment, you begin to continue to endure that trauma. So I think there's a space for therapy, or there's a space for counseling, and there's also a space for God. But even the Bible tells us that we have to, faith without works is dead. You have to actually do something to kind of pull yourself out of a situation, or start creating an opportunity for you to heal from trauma by actually being involved, right? So there's a place for prayer, but 100% there's a place for therapy or seeking counsel.
So the other thing we discussed, Kehinde, offset, was about the Bible talking about in the multitude of counsel there is safety. And you gave me a big revelation that even as therapists and as you try to help clients, you talk about safety as the first thing.
So the first thing you do when you want to do any type of trauma processing or any type of work with a client is to establish safety. That's the first thing we do.
Exactly.
And before we can even, do any type of processing, safety has to be there.
So the Bible has already laid the foundation for therapy. So for those of us that feel, oh, we don't need to process the trauma, we don't need to talk about it, we just need to pray and wish it away, the Bible actually supports that we get that help so that we can remain safe. Let's talk about the manifestation of trauma. We know is maladaptive reaction to some negative experience, whether that be a car accident, you finding a bear in front of your house, or emotional abuse that might not be so visible. What are some of the things that a person would see and say, hey, I'm having this is trauma? So what are some of the patterns?
Especially in our community, I would say trauma can show up as hyperproductivity, hyper-independence, hyper-vigilance. It can also be avoidance, you shut down easily, you don't want to address situation, you're avoiding conflict, self-doubt, low self-esteem, poor relationship with self and others. So your interactions with others as well is not, and then often at times there's a pattern, right? So being able to establish what those patterns look like. If you're a parent, there are certain things that we experience in our childhood. We tell ourselves, you know what, my parents did X, Y, and Z. I'm not going to do it to my child. But then we find that we are passing it on because we've not healed. And so we pass on those wounds. And our parents too did what they could with what they had, right? And so they also they pass down their pain. So we call that generational trauma. Pass down their pain towards us. And if we don't, start speaking up, I think, speaking up is one way to start the healing. And then raising our awareness. unfortunately we can pass it on to our children as well.
Absolutely. So very important that we address our trauma. We talked again, offset, about the ACEs, how adverse experiences, even as far back as childhood, can affect us as older adults, can affect our decision making, can be linked to some health problems. So it's very important to identify trauma and to seek help. Which takes me to my next question. How do we seek help
So
from trauma when we recognize all these patterns and everything?
there are multiple resources available. First, you can talk to your family doctor. They can do quick assessments for anxiety and depression. If it's intense, then they can do a referral to access mental health. We have if you're in Alberta, we have distress center lines called 211, especially for folks that are feeling suicidal. We have suicidal lines as well. There are directories that you can access for specialized treatment through Psychology Today. Podcasts can be helpful. Like if you are just curious and wanting to know, you can go on YouTube, you can go on podcasts and listen. There are books that you can read. I think Offset, I talked about Gabor Mate. He's a doctor that really talks a lot about trauma. There's a book that he calls How the Body Keeps the Score. That's a very good book that talks about how, what you were talking about, how trauma lives in the body and how it shows up medically. The long-standing trauma can show up in different physiological symptoms down the line.
So we also talked about online
Yes.
apps like Mind, Anxiety Canada is a very good one. Online CBT, some of them are free, some of them, of course, are paid. And the next question I'll be asking now is what can we do individually? For example, if Dr. T finds that, this is trauma, is there anything I can do within my own environment, in my bedroom, to bring down that temperature and deal with some of these patterns, agitation, being silent, shutting out, all the patterns that we discussed?
So one of the first things to do is learn to regulate your nervous system. And one of the simplest ways to do that is just breath work. And there are different types of breath work, but the simplest one is breathing through your nose, out through your mouth, being able to hold your breath and calm your body and notice the tenseness and the feelings of relaxation. So really that body attunement, really scanning your body from your head to your toe and just breathing through and really finding where, because also not only, there are other symptoms like your heart racing, maybe there are emotions as well, maybe elevated emotions. But sometimes if you really pay attention, sometimes I've heard folks tell me, I experience a tightness in the chest, there's a pit in my stomach. So these are all signs. And so you can actually learn to start to work through those through breath work.
Breath work is very important. Grounding yourself. Yes. We talked also about the senses, like sitting back, closing your eyes, and just saying, "Hey, what do I hear? What can I smell?
Yeah.
And just processing each of those. That can kind of help bring you out of that stage of anxiety, as it were, and helps ground you and clears your mind going forward. Now, I know there are different variety of treatments for trauma. Can we discuss some of them? I know you're a licensed EMDR provider, but what is EMDR? How does it help the patient with trauma?
Okay, so EMDR is eye movement desensitization and reprocessing, and that EMDR in particular is helps you to learn to rewire how the brain responds to traumatic events. And so it teaches the brain to process those traumatic events differently. So instead of having those maladaptive ways of coping, you're teaching the brain to, react in a way that is healthy towards you. And so we do that there are different ways to do that, but it's really about accessing the left and right side of your brain and teaching the brain to send a different message. So we're trying to build a new neural pathway. Because what happens with the maladaptive ways of coping is that has been repeated over and over and over.
Yeah.
again, and now you're trying to retrain. And so we use EMDR to retrain the brain.
Right. So brain retraining with EMDR, cognitive behavior therapy is
yes.
another one. And we also discussed offset about maladaptation to these traumatic experiences spiraling out of control, that some people may actually develop frank anxiety, depression, and even psychosis, which is when you completely lose touch with reality because of the bad way you've responded to something negative. It doesn't take away the fact that you had a terrible experience, but it's the way you're reacting to it. So you might just find yourself really sinking deep into a medical diagnosis if we don't nip it in the bud. So sometimes when unfortunately people get here, there is a place for medication, the right kind of medication and other kinds of support for the patients. The key thing is to seek help, and that there's really nothing to be ashamed of when you've
I want to
dealt with
quickly
trauma.
Go
ahead,
quickly
please.
add something that there's no timeline for processing unresolved trauma. I've seen clients. My oldest client at the time was 83 years old.
Wow.
83-year-old man that had, because that's what trauma does. It lives with you if it's unprocessed.
Wow.
So constantly waking up, could not sleep because of nightmares.
At 80.
Yes, at over 83. So this is real. So maybe if you are thinking, oh, I've been able to function. Yes, you've been able to function depending on your environment, depending on what's around you, but it's not always going to be consistent. There's always going to be that point where the brain will be like, I can't take it anymore. Right? And everything crashes. And that's where you have these, extreme cases of heightened emotions or psychosis or being 83 and not being able to sleep.
You can imagine that's almost a whole lifetime. And just really again focusing on the impact of trauma. And while we're still talking about that, is the role of relaxation in the form of yoga. We've already talked about breathing and all. So some other things you can do. And we're talking about the evidence behind this. I shared about a book I read called Ikigai, which is the art of staying young while growing older. And in that book, he talked about the Japanese. They have the highest life expectancy. In Nigeria, it's 56. In Japan, it's 86. So that means the average Japanese will live 30 years longer. And in this book, they were looking at some of the things that they did. It's not like they don't also experience trauma, but as part of their day-to-day life, they find time to unwind, they find time to ground themselves, they find time to meditate, they find time to breathe, they find time for yoga. Yeah, breathing is involuntary, but when you actually sit back, you talked about the box breathing, and take your time breathing through your nose slowly, count to 4, hold it for 4, and breathe out for another 4, and do that repetitively. You find that it just has a way of calming you down. And we talked about distractions as well.
Yes. So one of the things I tell folks, doom scrolling, it's so important that, when you want to rest doesn't mean be on your phone. I think you said your phone does not own you. You own the phone.
You own the phone.
You control the phone. So doom scrolling is also can be a maladaptive way of coping. Because now I found that a lot of adults, we don't connect. Even people in relationship, they don't connect anymore. They're just on their phone. And you're telling your brain, you're actually overstimulating your brain when you're doing that. And then they tell you later on they can't sleep. How can you sleep when you've been doom scrolling for 3 hours, right? Or being on the screen on television. So really the idea is, how do you learn to rest with intentionality? And so even if your mind is busy, you can journal, you can take out the words that are in your head and write them down, and then learn to practice. Gratitude helps as well, because sometimes we find ourselves in negative positions, and then we need to be able to kind of change that aura, change that energy. And so gratitude, being in a place of gratitude, three things you are grateful for. Write that down, sit with it, meditate, breathe through your nose, out through your mouth. So you have that complete release and deep, that deep breathing. And so those are little things that we can do. These are not replacements for counseling or therapy, but at least these are easy things you can start to do to kind of learn to regulate your nervous system.
Absolutely. Learning to regulate your nervous system by doing some of these things. And I think you've already kind of touched on my next question, which is the duration. And is there really a particular time? Does it have to be 6 months or a year? And then, oh yeah, now I'm healed from my trauma.
Yeah, so I always tell folks, I always say that people are not manualized. Everyone is different. There's no cookie cutter recipe.
Yeah.
So everyone's pace is different. And it's not a linear process. It's not from A to B. No, everybody responds differently. Two people can be in a room, experience the same trauma and respond differently. And so someone can be treated for 3 months, another person can be treated for a year. But the most important thing is to start the work. Start the work and also be open to, I think, what also makes, in terms of people that are wanting to have effective experiences with therapy is being open. Being open will get things going quicker. Not that, you don't need to be in therapy for a certain amount of time. It depends. It depends, but I think being open to it is a good way to start.
Right. We've talked about like the medical, social, psychological aspects of healing with trauma. What is the importance of a good support network system, especially for those of us living in the diaspora? And at this point, I would also like us to talk about your workbook for immigrants moving to the diaspora, because sometimes we have this trauma living back home in Nigeria. In my case, for example, there's so much support that we don't even have time to focus on that trauma. But moving across the ocean to a different country, a new way of living, more isolation, as it were, can be a time when that trauma really manifests. So what is the role of support networks in navigating trauma?
So I think support is very important. Finding your people, I would say finding your community and finding your tribe. Yes, that's an excellent word. Finding your tribe is really important because there's so much healing in community and when people have shared lived experiences, it makes it easier. It normalizes your experiences. It makes it much easier for you to externalize versus internalize. Because when you are isolated, you are internalized, and then if you are not careful, you become the problem. Meanwhile, the problem is the problem. And so it's so validating to have a community that you can support. So when you are a new immigrant, and there's a lot of intentionality that is required. So looking for spaces where you can find people that are of common mindset or common values as yourself, whether it's in a church space, whether it's in associations, mosques, and you can even, there is meetups. If you have certain interests, if you're someone that likes to dance or you like music, those are ways you can actually get outside of your comfort zone. Another thing I did is one of my first workbooks is navigating life as an immigrant, and I was just thinking, how do we make how do you start this conversation? How do you make it accessible for folk? And so this is a workbook. It's not a lot of pages, maybe about 43, 40 pages, but there's lots of writing. So it's very activity based. You can engage with it. You're not reading too much, but it also introduces the idea of, how do I get in touch with who I am? How do I understand why I'm responding to this situation? How do I begin to raise my awareness? Because that's where healing starts. I always tell my clients, for the fact that you've come to this session, 50% of my work is done.
Absolutely.
Yeah.
Absolutely. Thank you so, so much. So, what kind of message would you like to share with someone out there that's struggling with trauma, that's found themselves in this repetitive negative reaction based on their experiences? Any words for them?
Yeah, so your trauma is not you. Like I said, the problem is not you. And it's not an identifier of who you are. It's an experience that you had, and now your body or your brain is trying to protect you. So it's not a bad thing. It's just that now the brain has protected you in this way, in this maladaptive way for too long, and so it becomes unresolved. And so there is support. Reach out for support, speak up. I think what happens a lot of times is that when people stay silent, and not only the silence, but then it gets shrouded with shame and guilt, and makes it more difficult for them to step outside of that. But there is support. So reach out for it.
Right, and I'm going to be talking about one of those supports, which is Twin Ocean.
Yes.
So tell us about Twin Ocean.
Yes, so Twin Ocean is a private practice and also a company that provides products and services to support Africans and immigrants with their healing, helping them to stay culturally grounded and build self-trust.
Absolutely. And where can we find you?
Oh, yes, you can find us on www.twin-ocean.com. My book, this book here and these affirmation cards are on my website as well. And this is also available on Amazon.
Very good. Thank you so much. So they can find you.
Yes.
For trauma.
Yes, trauma work, sex therapy, relational work, identity work on twinocean.com.
Awesome. So please check twinocean.com to get the services that Kehinde renders and to heal from your trauma. I want to just thank you very much for being my guest on the podcast today. And I do hope that you continue to do what you're doing. I know it's what you love. I see your posts and I see the hard work that you're doing. And for our guests out there, I hope that you would also take the time. There's no shame to identify your trauma and to seek the right kind of help for it. Do you have any final words?
Yes, let me mention my Instagram.
Good.
So I'm on Instagram, Being Twin Ocean, and since January I started talking about family wounds. So if you want to tune in, you can follow me at Being Twin Ocean.
Being Twin Ocean, awesome. Thank you so much for joining us. Until the next episode, we'll see you. My name is Dr. T. Thank you so much.
Thank you. Bye.